Paranasal sinus cancer is a rare cancer occurring in the bones surrounding the nose. This comprehensive video will explore various aspects of diagnosis, treatment, and patient management to enhance medical professionals' knowledge and support of patients with this condition. Paranasal sinus cancer varies in incidence worldwide due to demographic, environmental, and occupational factors. Age, gender, race, and socioeconomic status influence rates. Understanding these patterns helps identify risk factors and potential prevention strategies for this cancer. In this section, we will explore the role of specific genetic and molecular markers in diagnosing, prognosticating, and personalizing treatment for paranasal sinus cancer. These markers include DNA mutations, gene fusions, epigenetic modifications, and protein expression patterns, which can help differentiate subtypes and predict patient outcomes. By incorporating these markers into clinical practice, we can improve accuracy and enhance patient care. In the field of paranasal sinus cancer treatment, surgery remains important for complete tumor removal while preserving normal sinus function. This section explores surgical approaches like endoscopic sinus and robotic-assisted surgery, as well as minimally invasive procedures offering advantages like reduced morbidity and improved outcomes. Staying updated on these advancements helps optimize surgical management. In this section, we will discuss the different techniques and materials used to reconstruct the paranasal sinuses after tumor removal. This is important for surgeons treating paranasal sinus cancer to ensure optimal patient outcomes and quality of life. Radiation therapy is crucial in managing paranasal sinus cancer. We'll cover when and how to use it, including dose fractionation and treatment planning. We'll also discuss potential side effects and management strategies. This is important for healthcare professionals caring for these patients. This section examines chemotherapy, immunotherapy, and targeted therapy for advanced paranasal sinus cancer. It covers platinum-based regimens, combination therapies, immune checkpoint inhibitors, CAR T-cell therapies, therapeutic vaccines, EGFR inhibitors, and VEGF inhibitors. Understanding these treatments is essential for medical oncologists managing this condition. Paranasal sinus tumors often encroach upon and involve cranial nerves, posing unique challenges in terms of management and functional outcomes. This section will explore the various treatment options for paranasal sinus tumors involving cranial nerves, including surgical resection, nerve-sparing techniques, and adjuvant therapies. Emphasis will be placed on strategies to optimize tumor clearance while preserving cranial nerve function, as well as postoperative functional outcomes and rehabilitation. Collaborative decision-making between otolaryngologists, neurosurgeons, and other specialists involved in the care of these patients is crucial for achieving optimal oncological and functional outcomes. This section discusses the importance of adjuvant therapy in the treatment of paranasal sinus cancer. It explores the use of chemotherapy and radiation therapy in combination with surgery to improve outcomes. The timing, sequencing, duration, toxicities, and impact on quality of life will be addressed. Multidisciplinary collaboration and individualized treatment planning are crucial for effective adjuvant therapy. Paranasal sinus tumors can arise from various locations within the sinuses, and the specific tumor location can have implications for treatment planning, prognosis, and potential complications. This section will explore the differences in outcomes and management strategies based on tumor location, such as ethmoid sinus, maxillary sinus, frontal sinus, and sphenoid sinus. The anatomical considerations, surgical approaches, reconstruction techniques, and adjuvant treatment modalities specific to each tumor location will be discussed. A nuanced understanding of these variations is crucial for tailoring treatment plans and optimizing outcomes for patients with paranasal sinus cancer. While paranasal sinus cancer is primarily sporadic, there are certain inherited genetic mutations and syndromes that have been associated with an increased risk of developing this malignancy. This section will explore these genetic predispositions and syndromes, including Li-Fraumeni syndrome, p53 mutations, and human papillomavirus, HPV, infection. The implications for genetic counseling, screening strategies, and early detection will be discussed. An understanding of the role of genetic factors in paranasal sinus cancer can improve risk assessment, guide counseling, and lead to early detection and intervention for at-risk individuals. This section focuses on the emerging role of immunotherapy in the management of paranasal sinus cancer. Topics include immune checkpoint inhibitors, CAR T-cell therapies, therapeutic vaccines, ongoing trials, combination strategies, and the underlying immunological mechanisms. Paranasal sinus cancer and its treatment can profoundly impact a patient's quality of life, both during and after treatment. This section will address the physical, psychological, and social aspects of living with paranasal sinus cancer, including the challenges faced by survivors. Survivorship care, supportive therapies, and strategies for managing treatment-related side effects, such as postoperative pain, facial disfigurement, xerostomia, and psychosocial distress, will be discussed. Devising comprehensive care plans that address these issues can help improve the overall well-being and quality of life for paranasal sinus cancer patients. In conclusion, paranasal sinus cancer is a complex malignancy that requires a multidisciplinary approach for effective management. This video covers various topics related to the disease, including epidemiology, molecular markers, surgical approaches, reconstruction techniques, radiation therapy, chemotherapy, management of cranial nerve involvement, role of adjuvant therapy, tumor location-specific considerations, genetic predisposition and syndromes, emerging immunotherapy, and survivorship concerns. By applying the knowledge gained from this video, medical professionals can improve their ability to diagnose, treat, and support patients with paranasal sinus cancer.